have reached Acme Medical Group and we are closed. Please call back during normal business hours. Thank you.
What you just heard is a common mistake, and a serious one. When a patient calls after hours, they're often worried, unsure, or experiencing symptoms that can't wait until morning. A message like this leaves them without direction. California's after-hours emergency requirements exist to protect patients in exactly these moments. Every provider office must give callers clear instructions for emergencies and a reliable way to reach an on-call provider when urgent questions come up. In this training, we'll walk through what a compliant after-hours system looks like, including the required emergency message and the 30-minute callback standard. These steps aren't just regulations. They're safeguards that ensure patients receive timely, appropriate care, even when the office is closed. Let's start with the most important requirement, the emergency instruction. Every after-hours voicemail or live answering service must clearly tell callers what to do in a medical emergency. The message should begin with a simple, direct statement such as, "If you are experiencing a medical emergency, call 911 or go to the nearest emergency room." Placing this instruction at the very beginning ensures that callers in distress hear it immediately without having to wait through additional details such as office hours or location. This requirement isn't optional. It's a critical safeguard that helps patients get the urgent care they need, even when the office is closed. One more important reminder. It is always appropriate to refer a caller to a suicide prevention hotline if they express thoughts of self-harm or emotional distress. However, this referral does not replace the required emergency instruction. Even when a hotline number is provided, the message must still include clear guidance to call 911 or go to the nearest emergency room in a medical or life-threatening emergency. The second requirement focuses on access to an on-call provider. After-hours patients must be able to reach a qualified clinician who can assess their symptoms and provide guidance. This access can happen in one of two ways. A patient may be connected to the on-call provider immediately, or they may leave a message and receive a callback within 30 minutes. A callback without a time frame, or one that takes longer than 30 minutes, is considered non-compliant. This standard ensures that urgent questions and concerning symptoms are addressed quickly, even when the office is closed. Timely access to a provider can prevent complications, reduce unnecessary ER visits, and support patient safety. Now that we've reviewed each of the ER after-hours emergency requirements, let's return to Acme Medical Group and take another listen.
You've reached Acme Medical Group. Our office is currently closed. If you are experiencing a medical emergency, hang up and call 911 or go to the nearest emergency room. If you need to speak with the on-call provider, please leave a message. Your call will be returned within 30 minutes.
The message you just heard is fully compliant with California's ER after-hours emergency requirements. It begins exactly where it should, with a clear emergency instruction stated before any office hours or general information. It also explains how callers can reach the on-call provider, and it sets the correct expectation for a callback within 30 minutes. And finally, it guides patients safely and appropriately, ensuring they know what to do if their symptoms require immediate care. This is the standard every provider office must meet. When emergency instructions are clear, on-call access is reliable, and callers receive timely guidance, we create a safer, more responsive system for everyone. Thank you for your continued partnership. Together, we ensure that every patient receives the right care at the right time, day or night.
For more information about timely access or other healthcare-related initiatives, visit iceforhealth.org for more information. Together with HICE, health plans are working to ensure timely care for all Californians. HICE, simplifying healthcare administration by working collaboratively with health plans and providers to improve healthcare regulatory compliance.